Hello everyone. So let's start with the discussion of ulnar nerve. So ulnar nerve, median nerve, radial nerve, these are the three important nerves in which we will study all the details. We will study about how it is formed, what is the origin, the entire course and branches of this nerve, and also the clinical anatomy related to the topic. So actually, let's start with the first of this nerve, that is ulnar nerve. Already we have discussed the topic of brachial plexus, and in which we have briefly discussed about few of the nerves and also the clinical anatomy. So if I talk about the ulnar nerve, we will proceed by firstly understanding that it is a branch of which part of the brachial plexus, then the course, relation, branches, and then the clinical anatomy. So let's start with this. So if I talk about ulnar nerve, it's a branch of medial cord of brachial plexus. Okay. So in the topic of brachial plexus, we have seen important branches of the brachial plexus, and we have seen that we have also discussed about the mnemonic, that is me for you, and we have seen many branches are there: medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial pectoral nerve, medial root of median nerve, and ulnar nerve. The whole of the branches which arises from all, and the whole of the nerves which is originating from the medial cord of brachial plexus is having the root value C8 and T1. If we talk about ulnar nerve, which is a branch from medial cord of brachial plexus, if you will see this, here the root value is C8 and T1, and in the bracket C7 is also written. Actually, this C7 component, here the C7 component is giving innervation to FCU. What is FCU? Flexor carpi ulnaris muscle of the forearm. So flexor carpi ulnaris muscle of the forearm is getting innervation from ulnar nerve, and that component is having the root value C7. So the root value of ulnar nerve is C7 in the bracket and C8 and T1. Now the other important point about ulnar nerve is that it is giving innervation basically to the intrinsic muscles of the hand. So it is giving innervation to most of the intrinsic muscles of the hand. So it is also termed as Nugetian nerve. Now, I would like to show you this. So let me just enlarge this diagram. This is a diagram in which we can appreciate the brachial plexus, and here you can clearly see the medial cord of brachial plexus. This is, so I would like to highlight this. So this is the medial cord of brachial plexus. Okay, having the root value C8 and T1, and here you can appreciate this is the ulnar nerve, and ulnar nerve is a branch from the medial cord of brachial plexus. So very nicely you can appreciate, yes, this is, if we talk about this nerve, this is the ulnar nerve, which is a branch from the medial cord of brachial plexus. Other branches are medial cutaneous nerve of arm, medial cutaneous nerve of forearm. Also the medial pectoral nerve is a branch. This is the medial pectoral nerve, and also giving part to the medial root of the median nerve. But here we are talking about the ulnar nerve, so it is quite clear from this image. Now, let's talk about the subsequent course and relations of the ulnar nerve. So when I am talking about the subsequent course and relations of the ulnar nerve, all important cords of brachial plexus, as we know, we have discussed the topic of axillary artery, and in that relation we have seen that the cords of brachial plexus are arranged according to their name around the second part of axillary artery. So if it is a medial cord of brachial plexus, okay, ulnar nerve is originating from medial cord of brachial plexus, that means medial cord of brachial plexus will lie medial to axillary artery. That means in the axillary region or in the axilla, the ulnar nerve is located medial to axillary artery. So this is what it is written here. You can see here, it runs onto the medial side of axillary artery formed in the axilla, and it traverses between, so it is intervening between, it is traversing between axillary artery and that of axillary vein. Okay. So let's talk. So after subsequently the ulnar nerve, after traversing from the axillary region, it will reach the arm, and in the arm region it runs just medial to brachial artery. So we know that lower border of teres major muscle, okay, at the level of lower border of teres major muscle, axillary artery changes its name to brachial artery. That means it is lying medial to brachial artery till it's the middle part of the arm. Now, there is certain changes which is occurring at the level of the middle aspect of the arm. What happens? It will pierce, okay, the nerve will pierce the intermuscular septum, and from the anterior compartment, it reaches the posterior compartment, okay. So, just see here, Firstly, in the axilla, it is lying medial to the axillary artery. Then after that, it is lying medial to the brachial artery. Thereafter, it pierces the intermuscular septum and enters the posterior compartment of the arm. Now, what you can see here, when it reaches in the arm region, what you can see here, the same thing which I want you to show here. So, let me just enlarge this diagram. And when I enlarge this diagram, first thing you can see here, this is the ulnar nerve. Okay. And here you can see ulnar nerve, which is lying medial to the artery. In the upper part, it is axillary artery. And in the lower part, it is the brachial artery. Okay. So, what you can appreciate the ulnar nerve at this level, as you can see, this is the intermuscular septum. So, you can see here it is piercing the intermuscular septum, and then ulnar nerve is traversing more posteriorly. So, this is the continuation of ulnar nerve, and it traverses into the posterior aspect of the arm. In the lower aspect, you can also appreciate that it is lying behind the medial epicondyle. It is traversing, what you can appreciate, it is traversing behind the medial epicondyle of the humerus bone. So, see here. Here, I want you to show the posterior aspect of the arm. This is a posterior aspect of the arm view, which is again enlarged here so that you can appreciate here. And you can clearly see this is the ulnar nerve, and in the posterior aspect of the arm, you can see it is running onto the posterior aspect of arm, and it is related to the posterior aspect of medial epicondyle. To be more specific, what you can again appreciate here, this is the olecranon process. This is the olecranon process of ulnar bone. This is the medial epicondyle, and exact location of ulnar nerve is between olecranon process of ulna and that of medial epicondyle of the humerus bone. Now, let's talk about the further course. When I am talking about its relation and the course in the elbow, so at the level of the elbow, it lies in the groove on the dorsal aspect of medial epicondyle, so which we have already seen in the image, and we have clearly seen in the image which has been used for the proper explanation that it is related onto the dorsal aspect, that means posterior aspect of medial epicondyle. Further, in the another image which I have highlighted, I have shown you that it traverses thereafter between the medial epicondyle and the olecranon process of the ulna. Now, so the same thing here again at the level of the elbow joint, the ulnar nerve has been shown. As you can see, it is traversing in between the olecranon process and the medial epicondyle. Now, after that, it will reach the forearm. After that, the ulnar nerve is reaching the forearm and it enters. So, when it is reaching the forearm, exactly it enters, it enters the forearm between the humeral and ulnar head of flexor carpi ulnaris. So, it exactly enters between the humeral and the ulnar head of flexor carpi ulnaris. Okay. We know that flexor carpi ulnaris, it's an important muscle of the flexor group of the forearm. It is having two heads of origin. One is the common flexor origin, that is from the medial epicondyle of the humerus bone, and the other is from the ulnar bone. In between that two origin, it is traversing, and that level and where it is traversing is given the name cubital tunnel. Thereafter, it lies superior to the posterior and oblique part of ulnar collateral ligament of elbow joint. After traversing between the two heads of flexor carpi ulnaris, it is lying superficial to the oblique part and the posterior part of ulnar collateral ligament, and thereafter it traverses lower down in downward direction towards the medial side of the forearm. Okay, this is giving innervation to medial part of flexor digitorum profundus and flexor carpi ulnaris, the two muscles of the medial aspect of the forearm on the flexor group. They are getting innervation from the ulnar nerve. The same thing I would like to show you. So, here you can see this diagram where you can appreciate it is traversing. What is this bony prominences? This is the medial epicondyle of the humerus traversing behind the medial epicondyle of humerus. Thereafter, you can see exactly the course of ulnar nerve it is running exactly between the humeral and the ulnar head of flexor carpi ulnaris, between the humeral and ulnar head of flexor carpi ulnaris muscle. Thereafter, as I told you, will run towards the medial aspect. It will be traversing towards the medial aspect. So it runs under the rest over the medial aspect of flexor digitorum. FDP means flexor digitorum profundus and lies under the cover of flexor carpi ulnaris. Okay. Now, one more thing is important. When you go for the dissection, what you can appreciate that ulnar nerve and ulnar artery is traversing together. To be more specific, ulnar artery, which is the terminal branch of brachial artery, is running radial to the nerve. That means its location is lateral to ulnar nerve. Thereafter, it gives palmar cutaneous branches. Thereafter, at this level, it is giving two branches. One is the palmar cutaneous branch and the other is dorsal branch. Now, let's see the further course at the level of the wrist. Now, one more important anatomical relation is that ulnar nerve is passing superficial to flexor retiniculum. What is flexor retiniculum? Flexor retiniculum, which is also called as transverse carpal ligament, which is bridging and running, which is covering the flexor tendon. So exactly it is very important for keeping all the flexor tendons together when they are traversing at the level